This is Barry Cohn at Really Great Employee Benefits. We're going to have our webinar today on ERISA compliance. It's not an option, it's the law. I want to make sure everyone can see the presentation and hear me. So in the chat box at the bottom left of the screen, if you can type 1 if you can hear me and see the PowerPoint. Appreciate that. We're going to hold our questions to the end of the webinar. So if you have any questions, just type them into the chat box, and I'll try to answer those at the end of the webinar. Webinar should take approximately a half an hour with questions and answers afterwards. So again, if you're online, I see a few people on. If you can type 1 to let me know that you can see the presentation and hear me, I appreciate that, so I know that everything's working. So we'll start with what is ERISA and why it's important today. ERISA was a law that was enacted in 1974, about 40 years ago. And it's a labor law that basically governs employee benefit plans, basically retirement plans, as well as health plans. Historically, the ERISA laws were focused on 401k plans, and every year people would have retirement plans, have to submit certain documents to the government. It requires certain disclosure to the individuals who are participants in the plans. But recently, ERISA has decided, or Department of Labor has decided under the ERISA laws to audit health and welfare plans, which is what we're talking about today. Health and welfare plans also have to have reporting and disclosure. Employers who are sponsors and administrators of the plan have a fiduciary responsibility for the plan assets. And they have to be in compliance with all the labor laws that affect health and benefit plans, including COBRA, the Affordable Care Act, and notices that have to be supplied to employees, like a HIPAA privacy notice, a family medical leave notice for companies above 50 employees, and a few other notices which we'll be talking about in a couple slides. ERISA is basically a law that covers private sector employees and employers, corporations, LLCs, partnerships, sole proprietorships, which is something that is a little unusual. Most people don't realize that if you're a sole proprietorship, you still have to basically comply with the ERISA laws if you have a health and welfare plan, and nonprofit organizations. Church plans are exempt, and since Really Great Employee Benefits handles about 15 churches, synagogues, and things of that nature, this is a question that comes up all the time. Church plans are exempt if it's just the church or just the synagogue, but if the church or synagogue has a day school or a camp or something other than just the religious institution, then their employees will fall under ERISA also. Examples of welfare benefit plans that fall under ERISA are health, dental, vision, life, disability, flexible spending accounts, health reimbursement arrangements, which have become very popular since the ACA has been passed 4 years ago, wellness plans and employee assistance programs, and also voluntary benefits that are offered on a pre-tax basis. So if a company offers Aflac benefits or Colonial benefits or Unum, as long as they're pre-tax, which is usually all those benefits except for life and disability, those would fall under ERISA also. So the question is, are you ready for an ERISA audit? And the answer is most employers are not ready for an ERISA audit because the ERISA audits have only been happening for the last year and a half, and people really aren't ready to prepare themselves for everything that's needed in an ERISA audit, which is what we're going to cover today. So the question is, why are so many employers out of compliance, and why is the Department of Labor focusing on this? Well, the answer really is the Affordable Care Act. There's basically an overall lack of awareness by employers of what documents they have to give to employees, what their requirements are under ERISA. They assume the carrier documents are compliant. So if a carrier provides the employees an evidence of coverage or a summary of benefits and coverage, and an ID card, most employers think, oh, everything's taken care of, it's not a problem. But in reality, that's not true. There's a lot of confusion over the complexity of the regulations. And what the Department of Labor believes is that 95% of employers have at least one violation, and 75% have at least two violations. In talking to a number of our clients over the last year, I would say that most clients have 5 or 6 violations, and that becomes a problem. The key requirements for ERISA are that there has to be a plan document. So if you have a health and welfare plan, i.e. a group medical plan, you have to have a plan document. The plan terms have to be specified and followed. There has to be a summary plan description, which is not the evidence of coverage or the summary of benefits the carrier gives you. If there are changes in the plan that are material, then the plan participants have to receive a material modification notice, especially if the changes are done outside of the annual renewal period. So if in the middle of the year, a company decides to change carriers and change benefits or change employer contribution, that requires a summary of material modification notice, which has to be given out 60 days prior to when the modification is done. A material modification under the law, under the Affordable Care Act, is a very slight modification, for example, 5%. So as an example, if a company offers an HMO with a $20 copay and they decide to go with a $30 copay, that is more than a 5% change. $20 to $30 is a 50% change. So basically any modification in benefits, office visit, out-of-pocket maximum, deductible, drug costs that are more than 5% really fall into this category. Copies of plan documents have to be furnished to all participants and beneficiaries, including COBRA beneficiaries, upon written request. And for companies above 100, they have to provide an IRS Form 5500 every year to the IRS and a summary annual report, which has to go to the IRS as well as to the employees. So why are these Department of Labor audits happening now? Well, I mentioned the Affordable Care Act. The Department of Labor, about a year and a half ago, hired 16,000 auditors just to audit health and welfare plans. They're not auditing 401k plans. Those auditors have been around for 40 years. Those departments are already fully staffed, but these are for health plans. The Department of Labor believes that because of healthcare reform, employers are in the bright light, so to speak. And in the next 4 years, the Department of Labor has announced that they're going to audit every single employer. And so the basic goal is to raise money to pay for the Affordable Care Act. And there have been publications from the Department of Labor stating that what their goal is to find violations and collect money in probably different terms than I just said. So what is the focus of the Department of Labor audit? The following are the main focuses: the summary plan descriptions, HIPAA privacy notice compliance, all the ACA notices. As an example, all children up to the age of 26 have to be covered. There's documentation to that effect. There's also something called Michelle's Law, which we'll talk about briefly, which has to do with kids that are 26 that are going through medical care. When they turn 26, there's a notice for that. There's a notice for coverage appeals, i.e., if you have a claim and your claim is denied and you think the carrier should pay additional money, what is the coverage appeals process, and is it written down into the employee's habit? And then MLR is medical loss rebates. Every year, a carrier in small group under 100 people have to look at each individual plan to make sure that it met the medical loss ratio of 80% coverage and 20% for admin. If they spend less than 80% on medical care, then there has to be a rebate to the company. But if the company pays, for example, 70% of the premium and the employees pay 30% of the premium, there's a rebate that's owed to the employees, and that money is a fiduciary responsibility of the employer, and so they're looking at that. Other items they're looking at are the exchange notice documents, which is the marketplace notice. Every employer, whether they have a health plan or not, has to provide the employees a notice that says, hey, we have a health plan, but we also have Covered California in California, and you don't have to take the health plan. You can go to Covered California or buy individual insurance. That's an exchange notice that has to go out. Employer mandate communication and documentation. So if it's above 100 employees and now will fall under the employer mandate under the Affordable Care Act, there's certain documentation that's required. Employer reporting requirements because of the ACA. Waiting periods. Waiting periods now cannot be more than 90 days from the date of hire, which in reality is 60 days from the date of hire because you can't join a plan in the middle of the month. So you have to make sure the waiting periods are proper. And according to the new ACA law, all new employees have to receive a sample of their benefits package within 14 days of hire, even though they're not eligible until the first day after 60 days of employment. So the Department of Labor is going to come in and say, how many new hires did you have in the last year? Show me where you gave them their employee benefits package within the first 14 days. If not, it's a violation. And then the essential health benefits. All the plans have to meet essential health benefits now, which are 10 benefits. All the plans that we are involved in selling, bronze, gold, silver, platinum, all are essential health benefits. But you have to prove that to the Department of Labor. So with all these notices and with all these rules and requirements, the question is, what notices do you have to give your employees? And the notices you have to give your employees are a laundry list of items which a lot of employers are not even aware of. So I'm going to break these down into starting with employers with less than 20 employees. And as I move up to over 20, over 50, over 100, all the notices that are for 20 and less are also required by all employers. So the first three we've talked about: summary plan description, summary of material modification if there is one, a copy of plan documents, the health insurance exchange notice, which is the marketplace notice, the summary of benefits and coverage. This is a 8 to 11 page document showing what the benefits are on the plan. The carriers actually produce those, but you have to provide them to the employees within certain timeframes. We'll talk about that a little bit later. Notice of modification of the plan, patient protection disclosure, which are really privacy notices. And then there's also a PCORI notice that has to do with taxes for the Patient-Centered Outcome Research Agency, which is a new agency that the federal government has created to look at medical plans and procedures and benefits to see whether they're cost effective. Other notices for employees with less than 20 employees are the Notice of Special Enrollment Rights, which has to do with people joining a plan in the middle of the year if they have a qualifying event. If you have a wellness program, there's now a wellness program disclosure notice. There's a notice of privacy practices. And then the next three are really important, and I find most employers don't provide them. The first is Women's Health and Cancer Rights Act. There's a notice that goes out once a year. The CHIP notice, although not in California, but for out of California employees, and I know there's somebody on here that has a employees in New York. We'd have to check to see if New York requires a CHIP notice. Michelle's Law. This is a notice that I wasn't even aware of until about 6 months ago. Michelle's Law is a law based on a woman named Michelle who turned 26 and therefore had to be taken off her parents' plan under the law, but she had some medical issues and she was under treatment. And it turns out that under the law, you can't take somebody off the plan if they're in the middle of treatment if they turn 26 for at least a month or so. And there's a Michelle's Law notice. Newborns Act disclosure notice. This has been around for a number of years, but basically the law states that a mother who has a delivery of a baby cannot leave the hospital within a certain number of hours for a vaginal delivery, a certain number of hours for a cesarean, and the baby has to stay in the hospital a certain number of hours, and a hospital cannot ask them or a doctor cannot discharge them early. And last, which a lot of smaller companies, meaning not national companies, are unaware of, is if you have any employees that are 65, and they qualify for Medicare, but they're on your group plan, you have to provide them a notice every year that the drug coverage they have under your health plan meets the Part D creditable coverage requirements. All the health plans that we sell and we are involved with all the carriers do meet that requirement, but that's still a notice that has to go out. So employers above 20. Well, above 20, you have basically the COBRA notices that are added to the package of notices. The first notice is a notice that I will tell you that 99% of employers do not provide. It's a general notice of COBRA rights. Most employers think, well, when someone leaves the company and they terminate, they're entitled to COBRA. That's when they get their COBRA notices. But in reality, when an employee joins a group health plan, they're supposed to receive a general notice of COBRA rights. It is a model notice that the federal government has that basically says, join the health plan. If you ever leave the company, you're entitled to COBRA. But of course, it's 3 or 4 pages because it's a government form. Notice of COBRA qualifying events if someone's terminated. They have a reduction of hours. They would get a notice of COBRA qualifying events and a COBRA election notice, allowing them to elect COBRA. And then once they elect COBRA, there's also a notice of underpayment if they didn't pay the full amount of the premium they have to. And there's a couple other notices regarding early termination of COBRA and notice of unavailability of COBRA. When early termination comes in a lot, and it's happening with one of our clients right now. We have a client that is selling their company as of today, April 30th. They're selling the assets of their company, and their employees are going to be terminated as of today, and they're going to terminate the health plan. Because they terminate the health plan, there is no COBRA rights. If a health plan doesn't exist, COBRA ceases to exist. So any employees that work for this company that are on COBRA, as of tomorrow, they're not going to have health coverage because the COBRA goes away, and they have to have a notice of early termination of COBRA coverage. So that's for companies that are over 20 employees. Companies that are over 50 employees also add the Family Medical Leave Act notices, as well as a mental health parity notice. In California, there's mental health parity. And there's a state law, there's also a federal law. For companies above 50 employees, it's a federal law, and it says that if you have a certain mental illnesses, such as bipolar disorder, schizophrenia, anorexia, bulimia, there's 7 items that are considered under the Mental Health Parity Act. Those have to be handled on an insurance policy the same as any other medical benefit. So for example, if it's an 80-20 split for hospital, 80-20 coinsurance, or labs and x-rays are 80-20, and the plan has certain requirements under that plan for all those benefits, the mental health benefits also have to parallel those or coincide with those. So there's a notice that goes out. And Family Medical Leave Act, above 50 employees, Family Medical Leave Act is in place, and companies have to provide family medical leave for employees that want to leave for a family emergency, a birth of a baby, a sick child, a sick spouse, parents. There's certain requirements, and those are required for all companies over 50. Over 100, you have the IRS Form 5500 and the Summary Annual Report. There's a question here, which I'll answer right now, is how is this 5500 different from a 5500 for my 401k plan? There's 2 separate 5500 forms. The 401k plan always will have a 5500 no matter what size you are. So my company that has 20 employees, we file a 5500 for our 401k plan, but we're not required to file a 5500 plan for our health plan. But employers with 100 and over employees have to file a 5500 plan, a 5500 notice also, that basically outlines they have medical, they have dental, they have vision, and there's certain documents. They're all uploaded, all done by e-transmission to the Department of Labor now. And above 100, you also have to provide the employees with a summary annual report. 401k plans also have summary annual reports, but this is for health plans. So medical, dental, vision, life disability, voluntary plans that are not but are pre-taxed, those types of things. So what does the Department of Labor want? Let's assume that they're going to do an audit and they come into you and they say, it's time to do an audit of your company. What are they looking for? So the Department of Labor is going to audit basically 49 items. 26 of these items are supposed to be copied and provided prior to the audit. In most cases, it has to be uploaded to the Department of Labor website within a certain number of days. It's 7 to 10 days. They have to upload it to the website. If the letter that you get from the Department of Labor says, we're coming in to audit you, then you have to make copies of it for them. The Department of Labor audit requests can go back 3 years, but they sometimes will go back 6 years. If they start finding problems, they can go back for 6 years. Audit reports include a summary, points out minor problems, points out major violations, talks about corrective action and what those fines are. And if the Department of Labor isn't happy with the employer, they can refer matters to the IRS for an IRS audit. And that is one that's kind of scary. It's kind of like if the Department of Labor comes in and does an audit, you want to make sure that you are completely friendly, in agreement, provide what they want, answer their questions truthfully, because if they start to get a little bit razzled, they may just turn you over to the IRS for an audit, and that's not what you want. I ran into a company in Compton a year ago that received a letter about a Department of Labor audit. It's a trucking company, and they were asked to upload the documents within 7 to 10 days, which they weren't able to do. It actually took them 4 weeks to get all the documents ready for the audit. So the auditors came in, the documents weren't ready. The auditors came back later. They got all the documents. They got some fines, not some major fines, but some minor fines. And they went on their way. So these audits definitely are happening. Usually the employer will receive a notification one of 3 ways, either a phone call to the employer, an employer might receive an email, or the employer might receive a letter. But usually have 10 to 15 days to comply and 7 to 10 days to upload documents where a full audit may occur. So let's talk about examples of required items. Now, of all the list of items that we've talked about already in this webinar, I just want to focus on a couple of them. Summary plan descriptions and summary of benefit and coverage, which is required under the ACA. This is an example of what the Department of Labor is going to ask for, and it kind of gives you an idea of the immense amount of work that has to go into being prepared for these. So the summary plan description, everybody has to have one, whether you have one employee on your plan or thousands. They have to be provided to the employees once a year. They have to be provided to COBRA beneficiaries also, which is one of the areas people forget to do. And actually, as I said earlier, most companies don't even have summary plan descriptions. I would tell you of our 500 clients, I will bet you that 450 do not have summary plan descriptions for their health plans. When and how to furnish SPDs within 90 days after a participant becomes enrolled or covered. If it's a brand new plan, so it's a company that never had health insurance before, I'm working on one right now. They own 4 Popeyes fried chickens. They're headquartered in Sacramento. They're adding 3 more stores. They're going to have 7 stores. They're going to start health insurance. Well, then they have 120 days to provide the SPD to their employees. Updated SPDs must be furnished every year if things are changed, and must be furnished in a reasonable fashion. So sometimes those plan documents could be furnished by attaching it to a payroll, the paychecks. Sometimes it could be emailed under certain safe harbor rules under the Department of Labor. But SPDs are something that employees have to have, and the Department of Labor is going to look at this very closely. It's actually the first thing they ask for. The SPD must include the name and type of plan. For example, really great employee benefits, health and welfare plan. Plan has to have a number. All the plan numbers start with 5. If you have a 401k plan, the 401k plan might be 501, which means the medical plan might be 502, the dental plan 503, the vision plan 504. The plan's eligibility requirements. For example, in my company, if you work 30 hours a week or more, After your first 60 days of, first of the month after 60 days of employment, you're entitled to join our plan. A description of what those benefits are, a statement of rights under ERISA for the employees, and the contribution, employer contribution. So you have to put into the SPD, the employer is paying 70% of the employee, 0 for the dependent, which means the employee pays 30% of the cost and 100% of their dependent. Dental and vision might be a voluntary at 100% of the employee, but that's got to be written out in the summary plan description. Updating the SPD, I think I mentioned this already. Anytime there's a material change or modification, you have to update the SPD. You also have to provide a summary of material modification notice, and that's something that the Department of Labor is looking for. So now we'll talk about healthcare reform and the summary of benefits and coverage. A group health plan usually offers multiple plans. For example, we offer 3 PPO plans with Aetna, and we offer 3 HMO plans, an HMO 20, an HMO 30. We offer a PPO 1000, a PPO 2000, and a PPO 4000. If an employee is enrolling for the first time, they have to have copies of every single SBC for every plan that they may enroll on. And then if someone's already enrolled in a plan and it's open enrollment, you have to provide them a brand new SBC every year based on changes that will occur in the benefits. I just went to a panel discussion of the head of Aetna, Anthem, Blue Shield, HealthNet, and Kaiser, but talked about small group plans and large group plans in the California marketplace. And they're talking about the fact that every single year now there's going to be change in the plans because the 4 types of plans, bronze, silver, gold, platinum, have to meet certain actuarial values. In a bronze plan, 60% of all the medical care has to be paid by the carrier, 40% is borne by the employee, 70-30 for a silver plan, 80-20 for a gold. And so every year, based on what the requirements are, they have to tweak the plans. So every year the SBCs are going to change, and there's just no way around that. So disclosure notices. The SBCs can be disclosed electronically via email under a Department of Labor safe harbor provision. If a single SBC is provided to a participant and beneficiaries, they have to be provided at the last known address of the participant or beneficiary. If the beneficiary's last known address is different from the participant, a separate SBC is required to be sent to them. So, for example, if you're an employer and you're going to send out the employee SBCs electronically, which we do for our employees, and my daughter, who's 22, is in Sonoma State, and that's where she goes to college, she has to get her own SBC, and it's got to be mailed to her because she's not in the company email system. And that's something the Department of Labor is looking at. I think by now you probably figured out the Department of Labor is looking for any violation they can charge you for. Timing. SBCs have to be provided, as I said earlier, within 14 days of a new hire coming on board. They have to get an idea of their benefits. We're recommending that you just provide the SBC in those 14 days and then give them an enrollment package when they're ready to enroll. If it's electronic enrollment, a lot of companies that are larger are doing an electronic enrollment. Those electronic enrollments, the SBC has to be distributed no later than the first date that people are eligible to enroll online. And special enrollees get 90 days from enrollment to get the SBC. A special enrollee would be the following example. I have a company that has employees and the spouse is not on the employee's plan because the spouse has other coverage through their employer. The spouse is laid off. That's a qualifying event under the IRS code, so they're entitled to special enrollment in the middle of the year. Then you have to give them the SBC within 90 days. That is a common violation. Since the employee already has the SBC, and to add the spouse, you fill out an application, you enter them in the system, they have medical care. You don't always think about providing a separate SBC for that new spouse that's on your plan, but that's a requirement also. Timing upon renewal. If the employee has to sign anything at renewal to acknowledge its open enrollment, which all employers do, then they have to get an SBC no later than the date the written application material is distributed. And also upon request, if any employee says, I need a copy of my SBC, you have to give it to them within 7 days. Penalties. These are penalties just for the SBCs. The Health and Human Services Department will charge you $1,000 for each failure to provide a summary. The IRS may charge you $100 a day per individual affected. The Department of Labor can also impose civil and criminal penalties. So as an example, if you have 15 employees and you did not give the SBC in a timely fashion and you waited 30 days, it would be $1,000 to the HHS department, and the Department of Labor will charge you $100 a day for 15 employees, which is $45,000, and you could get a fine of $46,000. If, for example, it was the spouse example I used in the previous slide, where a spouse joins the plan in the middle of the year and you forget to give them one, that could be $1,000 plus $100 a day until you give them one, which could amount, if you don't give it to them for 6 months, could be 180 times $100. It's, you know, it adds up. So this is an example of some of the penalties. There's other disclosures to employees too that have to be provided, and this is something the Department of Labor is going to look at. Copy of the latest SPD and summary material modification, if there was one. Insurance carrier contracts. I know a lot of companies, they get the contracts from the insurance carrier, they file them in a file drawer, or they throw them out, or they don't know where they're at. We get phone calls all the time from companies saying, do you have a copy of our contract? I need to read something in it, or I don't have one. All of the above must be provided within 30 days of request by employees, and penalties are $110 per day after the deadline if the plan administrator doesn't provide them what they asked for. Annual 5500 reporting for companies above 100. If you do not do a 5500 reporting in a timely fashion, it's $1,100 fine for every day the form is missing or incomplete. So that's every single day. If you don't do it within the number of days, and I'm not a 5500 expert, but I believe that after the plan year is over, you have 6 months to provide the 5500 to the IRS, Department of Labor, but I'm not positive about it might have changed recently. But figure out if you didn't do it on time, $1,100 a day, 30 days, you're talking about over $30,000 in penalties. Penalties are cumulative, and there's no statute of limitations on the 5500 forms. Violations for COBRA, HIPAA, Mental Health Parity Act, newborn, some of those notices are $100 per day per individual affected for each notice. And what is the penalty for not timely filing Form 8928? Well, the question is, what is an 8928? Which I'll talk to you about in a moment. In 8928, the penalty can be 5% to 25% excise tax, and a Form 8928 has to do with 5500 forms. No excise tax is imposed during a period when an employer did not know, or exercising reasonable diligence, did not know that a plan failure existed. So if there's a problem with the health plan, or you don't file a 5500 plan, once the plan failure is discovered, i.e. not sending out certain notices, or not filing a 5500 timely, or providing an SBC timely, no excise will be imposed if the failure is attributable to reasonable cause and the failure is corrected. Now, I don't know these days how many employers are going to say, I didn't know I had to provide these notices, but if you correct it within 30 days from the first date the error was known, and you file an 8928 form, you may be able to avoid the excise taxes. And I say may be able to avoid. It's up to the Department of Labor if you actually can avoid those taxes or not. Let me go back and just answer one question, because an employer who's on the webinar says, currently we have 98 employees, so we don't fall in the over 100. So everything that's required for under 100 employees are notices that apply to your company. Once you get over 100, there is a look back period. You have to be over 100 for a certain number of months. And if you're over 100 for those number of months, then you have to file a 5500 form in the following year, and the summary plan and this the annual report, summary annual report. So if you're under 100, then you have to do all the notices for under 20, 20 to 49, and 50 to 99. So let's move on to ERISA compliance solutions. There are many ways to be compliant and be ready for a Department of Labor audit. These are three of the third-party administrators that provide ERISA compliance solutions. TASC provides ERISA Edge. Infinisource is a third-party administrator out of Milwaukee that also has ERISA and COBRA plan, and Sterling out of Oakland. We've looked at there's probably 10 or 12 companies that provide these kind of services. We like ERISA Edge the best. We worked with Sterling for a year for our own company to test them, and I actually like the TASC ERISA product better. But no one forces an employer to buy an ERISA compliance solution, but I really think you have to think of it as cheap insurance to avoid penalties in a Department of Labor audit. But an employer has a business risk decision to make. An employer can provide all the documents without assistance. They can say, when we get audited, not if we get audited, but when we get audited, we'll provide everything to the Department of Labor ourselves. Or you can purchase an ERISA wrap plan that helps you get ready for that audit. A business risk decision, as an example, under California law, if one of your employees have a baby, you have to have a lactation room for them by law. It has to be a room with a door and a lock and no windows or window coverings, and it can't be a bathroom. And when this law was passed, I had a lot of employers say to me, I don't have a lactation room. I'm not going to do that. Well, if you never have someone that has a baby and never asked to nurse the baby or express milk for a baby, you don't have to worry about it. But that's a business risk decision. Do I have a lactation room? Do I not have a lactation room? If I have an employee that needs that, what am I going to do? How do I accommodate them? So the same thing goes with these Department of Labor audits. You can buy an ERISA wrap and protect yourself, or you can go uncovered. We're recommending to our clients that you purchase an ERISA wrap. They're basically fairly inexpensive given the vast amount of penalties you could have. So kind of food wraps, ERISA wraps. I wanted to throw something in there that looks kind of good in the middle of the morning here, because lunchtime is coming quickly. So let's talk about an ERISA wrap and what it does. An ERISA wrap is designed to capture all the company's benefits in one summary plan description. It contains the missing items that most employers have, and it wraps around the insurance contracts. So the ERISA wrap is a document that says, here's the plan administrator, here's the fiduciary, here's the plan number, the year, the plan name, here are the plans we have. It's intended to protect the plan sponsor and plan administrator, but it's just a wrap document. Attached to that wrap document, you have to provide copies of the insurance evidence of coverages, copies of the SBCs, copies of the notices. The ERISA wrap providers can provide the notice for you at a fee. For example, TASC charges, I believe, $300 to provide all the employees the required notices, and then that's attached to the wrap document. In our case, we provide our own notices to our employees, so we don't pay that $300 fee. But every year, January 1st, we have a whole bunch of notices we hand out to our employees. We ask them to sign an acknowledgement they received them. We put it in their personnel file, and we're covered on those notices. But the wrap document provides the vehicle to attach everything. The plan document, the SPD, the annual report, the healthcare reform notices, all notices can be attached, the SBCs. And then once you forward that to the ERISA wrap company, then you end up with one major document that you can just hand over to the Department of Labor if you get audited. So the ERISA administrators basically provide you record-keeping assistance, technical customer support, and they guarantee compliance. They basically say, if you purchase an ERISA wrap from us, we will make sure that if you get audited by the Department of Labor, you will pass the audit on the work that we do for you, and we will guarantee it up to $1 million. So if you had a fine, they'll pay that fine up to $1 million, but that's only on the work the ERISA administrator does. If you don't attach the evidence of coverage or the SBCs or the required employee notices or all the other items that are required, those are things the employer is required to do, and they're not going to indemnify you for that, but they'll hold you harmless for what they do, and they also tell you what you have to do, and you have to basically do it. I know that when we did our ERISA wrap a year ago with Sterling, we got the ERISA wrap document, and it took me 2 months to get everything attached to it and ready just in case I got audited last year. Lastly, if anyone has any questions that haven't been asked, I would ask you to type them in and I'll be happy to answer them. Really Great Employee Benefits is your best resource for information on the Affordable Care Act, HR, and ERISA compliance. If you ever have a question about HR, ERISA, Affordable Care Act, I'm always available by email or by phone to answer questions. We have a staff here of 20. We're more than happy to help you. The important thing is to make sure that you're aware of what is required of you, and then you make a conscious decision. Do I comply ahead of time? Do I not comply? Do I wait? Someone just typed a question we just purchased ERISA Edge. Does that include the wrap? Yeah, ERISA Edge is the wrap services, so that everything is wrapped into one document. If there's no other questions, I appreciate you being on the webinar today. We've recorded this webinar, and we plan on posting it to our website and also to LinkedIn. And if you want a copy of the webinar, we'll be more than happy to send you a link if you want to copy it again. I think that's about it. Thank you very much for attending the webinar today. And if you have any questions, please feel free to give me a call. Thanks a lot. Have a great day.